Good afternoon, everybody, and welcome to Facebook Live on Thursday. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management, and with us, as always, is...
I'm Annette Mercatante, the St Clair County Health Department Medical Director, Medical Health Officer.
All right.
What am I? Whatever I am today.
One of those. All right. Well, welcome, everybody. As always, we're going to go right over the data, and the data today for this week is 16,715 total cases, 669 people hospitalized, 343 deaths, and we have 9,246 people recovered currently. Our changes in the last 7 days: 1,080 cases new, 154 average cases per day. Our testing is staying about steady at 631 average tests per day. And really good news, our percent positive has gone down to 23.6. As you can see, the graph is showing that we did hit a peak about 10 days ago or so, and we are maybe a little short of 10 days, and we are coming down, which is good news. And we're taking a look at the data to see where we may end up, and that may be a conversation for a couple weeks from now. This is the percent positive. As you can see, we've had a couple of peaks in there, and we're holding pretty steady, like I said, right around 26% right now, and we are continuing to head down. I apologize, we're not holding steady. And vaccine data, everybody wants to know this. So we have administered 81,406 doses of vaccine here in St. Clair County. We've been distributed 106,630. Currently, we're at 39.9% for coverage for our residents. And really good news for our 65 and older group, we are at almost 65%, which is really good. And then finally, as always, you can find our up-to-date, up-to-the-minute information at stclaircounty.org/offices/health/covid19.aspx.
So you want us to go through
let's go through the talking points. So Doc, how about you start with yours?
So mine today is the importance of testing. And testing is and will remain, I think, a very important tool in our toolbox to try and manage the transmission of this virus. So it helps us in a lot of ways. It helps you identify that you're infected. If you don't know it already, it certainly gives you a heads up to isolate and prevent further transmission. Creating that circle of control around you. It helps determine the level of disease in our communities. So for us, testing helps us really keep a pulse on when we're starting to do well and when we're starting to not do well. And to find a testing location near you, visit our website at scchealth.co or go to the michigan.gov/coronavirus website. You can put in where you are and find the nearest testing locations.
Great, thank you. Justin, would you mind going over your talking points?
Sure. So as we've said in the last couple of weeks, FEMA is providing assistance for burial expenses, for funeral expenses. And you can find that information at FEMA.gov/funeral-assistance/FAQ, or you can also give them a call on their helpline at 844-684-6333. And I'm sorry, I missed the other one. So the other one we have is for our second dose appointments. Anybody who's come to our clinic and have been told, please come back again for your second dose, you're expected to come at the same time that you received your first dose. And you can find out the date and the time on the back of your card that will be given to you while you're getting your first dose. So we're just looking to get our return customers to come back and get that second dose so you're fully protected. And we're looking really forward to it.
All right, thank you.
Yeah,
I just
want to say, sticking to that schedule helps us out a lot as far as keeping the flow going. You can come that day, we'll get you the vaccine, but if you stick to the schedule, there's a lot less likely you're going to be waiting in a line or having a problem standing in line. So
thank you. I just want to do a quick shout out today to publicly thank Marysville Rotary for providing today's lunch to our staff and volunteers at our vaccine clinic. So thank you very much, Marysville Rotary, for doing that. Appreciate that. Okay, we're going to move on to the questions that came in last night before we move to the live questions. And just a reminder, everybody can rewatch the show after we're done. And we also put it on our health department YouTube channel, and it's time-stamped. So just 2 notes. Okay, we will start with Dr. Mercatante. This person asked, I'm vaccinated plus 3 weeks. How safe is it for me to mask myself and work where some of the people are not masked? I'm 68, overweight, and have O positive blood.
Okay, so we're going to eliminate the O positive blood because we just don't know if that's a real factor or not, but appreciate you asking that question. The question, I guess, I'm vaccinated plus 3 weeks. I'm assuming you mean you're past the second final dose of your mRNA, or you received a 1-dose J&J vaccine. That means your that 14-day mark has been passed, which we consider kind of the safety mark. Although data would suggest that the longer after you're vaccinated, the better protection you might get. So that's good. How safe is it for me? So let's define safe. Your greatest risk, of course, if you're not vaccinated, not masked, in a room full of people who are also not vaccinated, not masked. Your risk would really depend on several things. Whether or not the other individuals in the room are infected or not, or and that may be an easier question, are they exposed? Are they somebody that should be quarantining? And the other issue, of course, is what the rate in the community is. With very high rates like we have now, there's a pretty good possibility that if you're in a room with a lot of people, 1 or 2 of them are going to have the virus. So there is always that issue of risk benefit. Good for you for getting vaccinated. That is still our strongest, best tool to prevent ourselves from getting infected. And I would just, if you're in a room with people that you can't really assess the risk, wearing your mask and staying your distance from them is still your best bet.
All right. Thank you, Doc. All right, Justin, we'll switch to you. How do working people get appointments?
So obviously we've transitioned a little bit to walk-in clinics. And we're open from 9 o'clock in the morning until 7 o'clock in the afternoon for our once-a-week clinic. There are other times available for other clinics too. And you can find any of those clinics. The website is vaccinefinder.org or vaccinefinder.org. That will tell you where all of the public-facing community clinics are available in our community, which is really good news.
All right.
And there are some weekends, there's some Saturdays,
Yep.
more and more, there's some Saturday weekends, so you should be able to find something that fits your schedule.
All right, next question, Doc. Considering all the variants in our county, can 3 fully vaccinated couples safely gather inside without mask?
So recently the CDC did release their guidelines for fully vaccinated individuals and the kinds of things you can feel more comfortable doing if you're fully vaccinated. And that includes visiting inside a home in a private setting without masks with other people who are also vaccinated. And they used to say with just 1 other couple. So they've extended that a little bit. So if you're in a room, although I think the inside occupancy limit is still 10 people and 3 families, if I'm not mistaken. Is that right, Justin? You're the keeper of my regulations. That is correct. We'd like you to kind of stay with that guideline. And then you can visit inside a home in a private setting without a mask with unvaccinated people who are not at risk for severe illness. You can travel domestically without a pre or post travel test. You can travel domestically without quarantining after travel. You can travel internationally without a pre-travel test, depending on, of course, what that country of or where you're going. Some countries do require it still. You can travel internationally without quarantining, and you can attend medium or large gatherings. And that would be with masks. So I would just say that vaccinations do expand your ability to do things socially that carry a much lower risk. Now, you mentioned the variant, and how does the variant play into that? Right now, the variants that are circulating in Michigan are still very responsive to the vaccines that we're using. And we have no concerns right now of our vaccines not working well or just as well with the variants. So right now you're in good shape regardless of what variant is circulating.
Hey, Doc, speaking of that, somebody last night asked, what percentage of current cases are the variant and how many variants have been found in our county?
So we have found really quite, for the most part, B117. There have been a couple of cases of others in the state. I think we had 2 of a California variant here, but the vast majority are B117. So that's the one that we're keeping our eyes on. How many are part of our current transmission is impossible to say because, quite honestly, the state is not randomly selecting samples to run. So we can't take the number we know are here and extrapolate that to say it's a certain percentage. We've had well over 200 confirmed variants that have been reported to us out of the thousands of cases we have, but that doesn't mean that it's 200 divided by the thousands. Most of us feel that it's more than 50%, though. I think we can safely assume, what they just assumed that it was at least 60 to 70% of the population. Brandon, do you remember what they released? No, I'm sorry. So I'm not going to put a number to that. Scratch the number. Don't hold me to the number. But we can assume that more than half are probably variants at this point.
And one more thing that came in about the variants last night was apparently variants such as the UK B117 is putting people in the hospital, even those who are vaccinated. Is another booster shot in the works for the new variants?
So the B117 variant does not appear to be more lethal or more severe as far as its infection. There's a lot of people ending up at the hospital because there's a lot of people getting sick. It's more contagious, which means there's more numbers of people who are going to get sick with this variant. And as a result, proportionally, you're going to see more people. But it's not a more severe virus. The vaccine still works very well. The monoclonal antibodies still work very well. And there does not seem to be a greater degree of severity of illness as a result of it. What was the second part of that question? I'm sorry.
They wanted to know, is another booster shot in the works for the new variants?
I'm sure there is. And I don't know yet if it's going to be needed, but I'm almost sure that they're already kind of gearing up for whatever we need to do if we do see variants that don't respond to our vaccine.
All right, thank you. All right, Justin, this person asked, I heard the National Guard will be coming to our schools. Can you provide more information?
Yeah, so last week we made the request to the National Guard, the health department did, to provide vaccination teams for assistance in being able to touch some of our school districts for that 16 to 18-year-old group. So they are providing vaccination teams, and I want to talk a little bit about what a vaccination team is. It's when the National Guard deploys for vaccinations, they deploy one medical person that's able, a vaccinator, somebody who's able to give the vaccine, and 2 support staff to help that vaccinator. So we are getting between 10 and 15 people from the National Guard to help us in this endeavor, which is really good news. But it's not like the National Guard coming down the street in all their trucks. It's literally 10 to 15 people that's providing us this much needed help to help our communities, especially out of the central part of the county.
Do you want to talk about when those clinics will be held? Those are in your notes there.
Yeah, I'm sorry. So Tuesday, clinics will be held at East China. We don't have an actual facility yet. We're still working on that. And at Port Huron Northern. And then on Thursday, the 29th, we'll have a clinic at the Port Huron Area School District Administration Building. And those vaccines, again, are for 16 plus and their parents. There'll be more communication from each school district in the coming days and weeks on this program. But we wanted to make sure that you all had as much info as we have currently.
Yeah, and the schools are going to be doing their own marketing for that. So thanks for emphasizing that. Okay. Lastly, Doc, question from last night. Is it rare for a young person 0 to 50 with no underlying medical conditions to die from coronavirus?
Yes, it's rare. It's not impossible. What's the data you guys gave me? As of April 22nd, 4% of our known COVID-19 deaths here in our county were residents among the individuals between the ages of 0 and 50. I think what's our youngest death? 20s, in our 20s. So yeah, it's rare, but it's not impossible.
All right. I'm sorry, I missed something from last night too. Two more. Any updates on vaccines for seniors unable to leave their homes?
Yeah, homebound do now have an option of getting vaccinated. I don't know when that's going to start. I believe that process is beginning, if not already started, through our VNA, the Blue Water VNA, and we thank them for that. So again, if you have somebody that's truly homebound and can't be put into a car and driven through a drive-through, then send that name and contact information to our COVID-19 at stclaircounty.org, and we'll make sure to hook them up.
All right, thank you. And we'd like to just shout out that along with BNA, it's also a partnership with Council on Aging and also Area
Sure.
Aging 1B. Okay, and you both can answer this last question. When is it going to get better?
And the famous words, those are old enough. It depends on what it is, right? What is it? What do you mean by it? Yeah, let's just leave it at that. What do you mean by it? Is the virus going to go away? I doubt it. This disease is here to stay. We'll get a lot smarter knowing how to deal with it. We may end up with better treatments. We may even end up with a treatment that can get rid of it. So that might make it better. Science is our friend. Vaccines are going to make it better. But is everything going to stop where you no longer have to worry about COVID? I doubt that. I think we're just gonna learn to live with it better, and the it is gonna get better, but it's probably not going to be the it that you remember 2 years ago.
Yeah,
Justin,
and I'll just add to that a little bit. Yeah, so in my opinion, like Doc says, we're going to learn how to live with it. We will see the restrictions and other things like that, continue to be changed and updated to loosen them. And I think as we move through time, just all of a sudden, it won't be our main topic of conversation anymore because, like Doc said, we've learned to live with it. We've had the science to help us through it, to save lives that couldn't be saved a year ago. We're getting better and better every day at the medical treatment side, and that's seen through the monoclonals, through the vaccine, and through other capabilities that they have in the medical field.
Okay, thank you. All right, we'll move to the live questions. First, I just want to mention that thank you to Jeff. He said he got his second shot today. Great job, St. Clair County. Everything went smoothly. Thanks, Jeff. That's nice to hear. We appreciate that. Okay, this is from Will. What can you do to help business that are afraid to turn away customers that refuse to wear a mask? If there was a partnership between all the business to turn away customers, wouldn't they be afraid of losing the business?
It's a great question, and I think we have turned to our business partners. St. Clair County has a very robust Economic Development Association and the Blue Meets Green, and we've been working with them now for the past couple of months to work on business responses, business support. I'll be sure to pass that along to them. I think, like everybody, we're trying to figure out what's the best way to support businesses. Right now, obviously, we're focusing on vaccine, but there's more to this response than just vaccine. And so I agree with you. I think a collective response sometimes builds a business's ability to do what it needs to do to keep its workforce healthy. So thank you for that.
Thank you. All right, this was another nice thing from Jenny. She said the vaccine clinics have been run so smoothly, straight in and straight out today. Nice job to all. Jennifer also says, bravo to all the workers of the second dose clinic in Marysville today. All right, Brian asked, why are people that have already been vaccinated still getting COVID and being hospitalized? This must make some people hesitant to get the vaccine. I am vaccinated, but I am all for it. But this is concerning that people will not get it because of this reason.
So I'll go there, and I'm not going to Brandon if we have data yet. It's still very preliminary, but I can tell you what we have been able to look at very specifically through, for instance, occupational health programs at McLaren Hospital. Yes, there are a few people who get COVID after vaccination. We knew that would be the case because nothing is 100% effective, but it is a very few people. And for the most part, for the vast majority of them, even if they do get sick, they're much, much less ill. So it's still a win. I mean, you're talking about the percentages that are just infinitesimally small compared to the risk of getting infection when we have a large outbreak. Do you have numbers? Less than 20 in the whole county that have potentially had an infection after being fully vaccinated. So if you're looking for perfection, you're quite honestly, you're being very unrealistic. Nobody can kind of hold up to those standards. There's nothing we have in medicine that works all the time 100%. But I can tell you there is no way you can compare the rate of disease after a vaccinated person to the rate of disease in a vaccine or immune naive community. It just pales in comparison. So,
yeah, and I
Thank
just
you.
did the quick math on that. It's 0.00024, 0.00024% of people that have been vaccinated in our county have had breakthrough infection.
I think the data I've seen throughout the country is showing that in the real life, breakthrough cases is way, way less than the 5% we were expecting. Remember, the clinical trials were showing at 5% or 95% effective rate, which means 5% weren't effective. And in the real world, it's more like what you're talking about, Justin, less than 0.01. So we're all very happy, actually, with the effectiveness of this vaccine.
Thank you. I just got somebody that just told me that when we were talking about the National Guard coming in, that East China, it's the Marine City Middle School when they are going to be.
Perfect.
That's what they're going to be, and also the clinic is at Port Huron Northern that they talked about, and the other one is not at the administration building. It's at Port Huron High School.
Okay.
Their cafeteria, I believe.
Clarify that.
What I've heard.
Okay, so Tuesday, Marine City Middle School and Port Huron Northern, and then the Thursday one is Port Huron High School. Okay, moving on. Any new information on the booster?
There is no booster yet. They're talking about it because they're talking about it. Right now, there appears to be no need for a booster, but I'm sure that in some lab, they're actively prepping to be able to respond to that if they need it. So at this point, take the booster out of your head. Right now, we're not talking about boosters. Right now, we're still worried about getting enough people vaccinated to even reduce the transmission of the next wave, which I'll just be the first to predict that if we don't get ourselves vaccinated, more than 40%, we're going to see another wave, and probably going to see another wave by summer, if not sooner. So get yourself vaccinated, people. Don't worry about the booster. Just get yourself vaccinated.
Somebody questioned. Oh, go ahead, Justin.
Oh, I'm sorry, Jen. And like look at places like Israel. They've got an 80% vaccine uptake for their entire country, which is fantastic, right? And right now,
Israel is doing things like removing mask mandates and allowing people to go back into and having weddings again. Yeah, there's been a lot of discussion about that. We'd love to be Israel. Well, be like Israel when it comes to their immune protection right now against COVID. Yeah.
Yeah.
I'm sorry, I cut you off.
And that's okay. And there's other places too, like New Zealand and Australia, who have pretty much cut out COVID because they've had a really great vaccine uptake, and they've been able to kind of close themselves off a little bit for long enough to make the levels very low. So we know that these things that we're asking our community to do, like take the vaccine, be distant, make sure you're careful when you're in groups, all of those things, we know that they'll work because it's happening around the world. It just is, it's really difficult in the United States right now for many reasons.
Okay. Now, I don't know if this is just on my end, but I can hear you guys. I can see the questions, but I don't see it on as I'm looking on my phone. So Elise, I don't know if you can tell that. This is just a technical thing. If people are seeing you guys, you see it yourselves? Okay.
Yeah, we can.
All right. The next question was somebody needed clarification. Mary asked, I thought it was 15 people and 3 families for indoor gatherings.
I can pull it up while we're going through and
Okay,
make
would
sure.
you check that?
Yeah,
They
pull
may
it
have
up right now.
adjusted the numbers. I apologize. They're hard to keep up with.
They
Okay.
did just change it on Friday, so let me
I
look
have
real quick while
people-
you're talking.
Okay. This is from Joe. He asked, how do we decipher the community spread with respect to children K through 12 and the numbers seen on the chart that we often see showing numbers of cases per day?
How do we decipher the community spread? I'm not sure what you mean with respect to school children K through 12. I've mentioned this before. So the spread within a school building can be roughly correlated with the general community spread. So when the community spread's very high, we have more difficulties with cases in the schools. Our K through 12 schools throughout the county work very hard trying to keep track of those, watching and trying to figure out where they come from. And when they start having difficulties with absenteeism rates, with the evidence that there might be transmission within the schools as opposed to outside the schools, and quite honestly, difficulties with staffing because of isolation quarantine, then we have to make the decisions. They have to make the decisions to pause, which we've now gone through a couple of times. But there is roughly a correlation between case rates in the community and case rates in the schools. I mean, it just makes sense. Most of the kids and the staff have lives. Well, I'm sorry, they all have lives outside of school. So. And that is really where the majority of them get their infections. I'll still maintain that if properly maintained, and I think all of our schools, quite honestly, are doing a good job. Schools being in class is still one of the safer things you can do in this community, with or without high case rates. Schools make sure that they maintain masking. They try and keep distance. They know who's in and out of the school buildings. They can keep track of who's been there. So it's not really the school that's the problem. It's really just what happens when you get people together in a group. I'm not sure I answered that question, or if there was if you were looking for a different approach to that. And I apologize if I didn't hit that. Maybe you could clarify what you wanted.
Hey, Justin, can you see the questions right now? Because for some reason,
I can.
they're gone
Yeah, I can.
from my screen.
And
so go ahead till I can get back.
Okay, and also it is correct. It's 15 people from 3 households indoors and 50 people outdoors for residential.
Thank you. That's why I have a team. Thank you, team.
Yep. So
how many people outdoors?
50, 50.
50. Okay.
How do we decipher the community spread with respect to school children K through 12 and the numbers seen on the chart that we often see showing number of cases per day? So if you remember last week, we showed a data poll where we had it broke down by age. We do have that data. It's just sometimes more difficult to talk about and people understand all the nuances of things like community spread. Doc, I think you would agree that we're still in community spread right now. We're definitely not out of that with 23%.
Yeah, you look at those numbers; they're still really high. And if you remember the numbers broken down by age, aside from the very beginning when we first started to see this surge, we saw a big spike in that younger age group. That's why we knew that we were having a little trouble at the beginning. Now it's pretty well evened out, which means you can't really look at an age group and say they're somehow more or less at risk. It's
Right.
not going to help you one bit.
Yeah, I think the best way to say that is we're all at risk until we get the percentage down, get the number of cases down, and we get as many people as possible vaccinated. Yep.
Mm-hmm.
Keep going, Justin.
All right.
My screen is
I'm
black.
sorry. Is it rare for a young person with no underlying medical conditions to die from coronavirus? Yes, Doc,
Yes.
I answered that a few minutes ago. It is. Doesn't mean it won't happen, but it is rare. I received.
It's not rare. I'll just do one more thing. It's not rare for that young person then to spread it onto their family members who may not be so young and healthy, and they have problems. So that is the problem with young people transmitting this. They're just as capable of transmitting the virus, even though, thank God, they're not as likely to get sick and die. But many times their family members do. So that's the problem. Go ahead.
Yep. So Cindy writes, I received the J&J. Should I worry? It's been 12 days. So you should not worry. You just need to be aware that they've had 9 cases of this kind of super, they've had 9 cases of incidents where they've had clotting, but it's related to at least 1 or 2 other things. It's not just normal blood clots. It's a very specialized blood clot. So just pay attention. If you have any changes and you're worried about it, get a hold of your health provider.
And Cindy, let's talk for a minute too about relative risks. So you have a 10-time risk, a greater risk of having that same kind of rare, unusual cerebral thrombocytopenia kind of thing that's unusual from getting COVID. Now, COVID, we know, the disease creates a great deal of weird inflammatory clotting problems in people. So you have a greater risk, if you're young and healthy, of getting hit by lightning, quite honestly, than having this particular problem with the J&J vaccine. So nobody's saying don't consider it. I'm glad that this surveillance system that we have was able to pick up such a small signal and be able to pull this and study it. But quite honestly, I think the potential risk for this is so small relative to the huge risk that we see with the virus that I'd be very surprised if we're not using this vaccine again in the future. So don't worry. And going back to Justin, this is not a subtle side effect. If you have a blood clot in your brain or in your gut or your lungs, you will notice that there's something significantly wrong. It won't be subtle. So if you're breathing and walking and feeling pretty good, I wouldn't worry about it.
All right, the next question comes from Amy. So should we feel safe that we are fully vaccinated and gathering with others that are vaccinated with these variants, especially if the variants don't respond to the vaccine? How safe is this? So the variants that we have in St. Clair County are all being handled by the vaccination.
They do respond. They do respond to the vaccine. Okay, the vaccine works great against the variants. So get that off your mind. Go ahead.
Yep. Yeah, that's all I was going to say. So.
Okay. Well, then I'll just.
Go ahead. You're good.
You're gonna be so glad that I'm done here. The word I keep going back to is safe, people. This is not like pre-March of 2020 where you will no longer have to worry at all. The vaccine is not 100% effective, so you've got to consider who are you hanging out with. Are they other vaccinated people? Are they high-risk people? Are they people that are ill currently? Are they people that have recently been exposed to COVID? These are all things you need to consider. So it's always better to hang out with people you know, where you can kind of understand those subtleties. So nothing is 100% safe. It is definitely lower risk. So if I had to choose between hanging out with some people, I would want to hang out with people who are also vaccinated and not showing any signs of COVID. So I hope it helps, but I cringe when people say safe because we don't want to give people the false impression that we're going to just wave this magic wand and all the problems are going to go away. But it definitely helps, reduces the risk.
So Leanne writes, that's how I pictured it, and she was talking about when I was explaining what the National Guard push looks like. Like I said, there won't be any trucks in the street or anything like that. It's 10 to 15 people in uniform providing vaccines.
Yeah,
so,
I would think if you walk in there, you won't notice any difference than any of our other vaccine clinics, other than they might be in uniform, right? Will they be in uniform? Okay.
They might be. The support staff will be, but the vaccinator may be in scrubs. So because they're a medical person. So if Ellen asks, if you tested positive for COVID, when can you get vaccinated, Doc?
As soon as you feel better and are out of isolation. So the isolation period for COVID, remember, is 10 days from the date you got sick. So if you got sick on a Monday, you'd have to wait till the following Wednesday. And I would assume that you're going to be feeling better too. So if you're still feeling really crummy, one of the things we know about COVID is even if it doesn't kill you, about 30% of the population gets really feel bad. It's kind of a prolonged illness. And I would recommend that you start feeling better before you get your vaccine, even if you're past the 10-day mark. Because as we know, the vaccine can give you a couple of days of feeling kind of blah. So we hate to add that to you already feeling bad. Now,
Yeah,
Justin, did you? Go ahead.
I
Go
just
ahead,
go
Doc.
while we're talking about when to get it. So a caveat to that is if you are sick and you get the monoclonal antibody therapy, which is something you would know you'd get because it's an infusion. Someone puts an IV in your arm and infuses this through your veins. So you'll know you got it. It's an outpatient procedure. But if you get that while you're sick, then you have to wait 90 days. Okay. That's the only caveat to that. So it's 10 days if you're just sick and recover. It's 90 days if you get monoclonal antibody therapy for COVID. There are other monoclonal antibody therapies and they don't count. Okay.
And
Justin, did you answer the question from Chris Brennan? Can you comment on the new India variant, Texas variant? That's the first question I'm seeing on my phone.
yeah, that's pretty far down the list still, I think.
Okay.
So how about we wait on that for a second, and
Okay, go ahead.
and I'll just. So what we were just talking about, Janine Sloan writes, what happens if you're scheduled for the second half of vaccine and you get sick? Also, what happens if you get COVID in between your vaccines? Do you still get the second shot? Yes, you do. Like Doc said, either after the 10 days after you start feeling better, or if you get the monoclonal treatment for COVID, you must wait that 90 days. So those two questions were correlated, so I wanted to make sure we answered that.
Sure.
And then Catherine writes, if you had a vaccine and you get COVID, can you receive the transfusion treatment?
Yes.
And the answer is
yes, because
yep,
the vaccine doesn't have anything to do. Well, the vaccine doesn't have any COVID virus in it. Okay, so the monoclonal antibody will still help you if you get infected, despite whether or not you had the vaccine or not.
Rhonda writes, both my husband and I got our second vaccine last week. So good job. Thank you so much for being part of the vaccinated crew. That's right, part of the solution. Gina, any studies with people with autoimmune disease and this vaccine?
I have not seen anything specific. There were people with autoimmune diseases in the clinical trials, the phase 3 trials, and there did not appear to be any undue changes with their disease process, nor has there been any increase in autoimmune diseases reported in our, as I've mentioned, very robust multi-layered surveillance system. So this is the same surveillance system that found these rare blood clots with the J&J. With the 180, 200 million doses of vaccine that we've distributed, there have been no signals of increased autoimmune diseases. So, in fact, there's been no signals of increased deaths, any of the increased things that people are worried about. So that's very reassuring when it comes to the safety of this vaccine. We'll continue to report on that if we find any changes. Now, what we don't know is if you have a specific autoimmune disease, and there's so many of them, whether or not your autoimmune disease or the treatment you take for that will impact how well the vaccine works. So that's really the issue with things like that, is the vaccine may not be as fully effective for you, but right now we don't have any real data to kind of tell you how much less or what type, nor do we recommend using post-vaccine blood tests to identify whether or not you've responded to the vaccine. So I want to make that very clear. A lot of people are getting serology for antibody testing after their vaccine, and I think it's a waste of money, because we really can't really tell you whether that antibody is protective. It's not going to tell us whether you need a booster shot. We're just not there yet scientifically to say that test is of any real value. Likewise, if you get a blood test for antibodies after a vaccine and it's negative, it does not mean you need more vaccine. So you can see why it's not really helpful to get one. We can't really base any judgment or clinical decisions on it. So just wanted to throw that out there. I get that question a lot.
All right.
Justin.
The next one is, can you still spread the virus after being vaccinated? And yes, there is a potential for that, right? Yeah.
Probably,
So I
maybe.
think,
I mean, yes, probably. Number one, we already know that it's not 100% effective, and we know that some people still get sick. It's probably a lot less, but the trouble is right now we just don't have the data to tell you how much less. So that's why we say if you get vaccinated and you're going out into public places, please still wear your mask, etc. But it more than likely will end up that your risk of spreading the virus is much less after vaccine, because that's what is true for all of our vaccines and all of the illnesses we vaccinate for. But we still don't have the data to really quantitate that and tell you how much less. So you can't let your guard down for that either, unfortunately.
Okay.
Completely.
I apologize. I was having technical difficulties. So the question that I see is from Chris Brennan. Can you comment on the new India variant, the Texas variant?
One out of hundreds. There are so many variants now. I think we wait, quite honestly. There are variants of concern, and there's variants of no concern, and then there's variants of, like, there's 3 levels of grave concern or immediate concern. And the surveillance system that hopefully will become more robust throughout the country will give us, with any luck, some heads up if those are becoming dominant or spreading, and we're just going to have to rely on the science to guide us with that. Some variants are are nothing, and some are much more concerning. I don't know I don't know anything specific about that particular one, but there's a number of them that we have concerns of because of their, as people have mentioned, concerns about reductions in vaccine efficacy, concerns about monoclonal treatment efficacy. But the variant that we are currently dealing with in Michigan is not one of those. We'll continue to watch.
The next question I see is from Robert. How many people in St. Clair County have had the vaccine, and what is the percentage of people? And Justin, you covered that in the beginning.
yeah,
Say
so
it
we've had
again.
83,000 doses, and right around 30% of the county is
Nope,
fully protected.
closer to 40. Oh,
Oh, I'm sorry.
close to 40% have had at least one dose.
At least one, right.
How much? A little over 50,000 people have had at least one.
Yep.
All right, this
Not
is
enough
from
people.
this is from Kenneth. How is St. Clair County doing? They didn't mention us that much. I'm not sure what Kenneth is referring to in that. So if you're
How are
not
we
sure,
doing with vaccines? We're below the state average.
Okay.
Some are doing better than us and some are doing worse, but it's not enough. 40% of the population having at least one dose is not nearly enough to protect us from another wave. There's still too many immune naive people out there, people who don't have any protection. So we need to get that. We need to get that closer to 70%. We really do, and that means people stepping up to the plate. If you're not sure, you're going to have to get your mojo up and come out and try it. It's not that bad.
Justin, I can't see anything before Chris's comment. So someone said that I skipped their question. So can you see where?
Yeah, I'm looking for it right now. I just saw that too.
Okay.
Kathy O'Neill. Let me look for her.
I can
And
do a question.
this will be my last question too, because I've
Okay.
got that other appointment. I don't, Kathy, I don't, oh, there it is. Are there hotspots in the county? And the answer to that is
Not
everywhere
anymore.
in the county right now. Yeah. Everywhere in the county is seeing the same number of transmission, the same opportunity for transmission.
Okay. I apologize. Justin's got to go, and I can only see certain questions. So if we missed you, please email us after the show, and we will get to those. Okay, this is from Rondé. Are the 15 indoor/50 outdoor numbers the maximum for fully vaccinated gatherings too?
Oh, Justin, where did you go when I needed you most? I'll have to consult with my regulatory people and get back to you. I'll have to answer your question later. I don't want to answer that. I think when you're fully vaccinated, there is this kind of vague statement where you can gather outdoors. So I'm not sure if that refers to fully vaccinated or not. I would think that you should feel a little bit more comfortable, but I'll talk to you about it. Sorry.
Okay, the next question is, do you know how close we are to getting vaccinations for children?
Probably a month or so away from seeing a reduction for Pfizer for 12 years old and older. For children younger than that, for the Pfizer, I don't know. And I'd only say a month or so away because we're starting to talk about it at the state about how we would do this and what it would look like. So everyone is kind of assuming that that request for approval has been submitted and it's just got to go through the regulatory channels. So we might see that first. For all children, maybe younger than 12, what I had heard earlier, it might be the fall, but I think I'm not sure beyond that.
Okay. The next question I see is, can the vaccine shed onto others?
Shed. Oh, the vaccine shed. Oh, no. The vaccine doesn't have any virus in it. So the vaccine is in no way is possible of creating any kind of infection. And when you say shed, you mean that the virus is in your body replicating and, reproducing and then comes out of your body to infect other people. That can only happen with an infection, and these vaccines are not capable of causing an infection. There's no virus in them.
Okay, Leanne said, appreciated the way the information is being presented in a calm way. So thank you. Bob says, thank you for all you do. Beverly asks, are inmates at the jail being vaccinated?
Yes. So we've had several vaccination programs there. Initially, when there was limitations, we obviously did all the jail staff, those who wanted it. And the inmates have been offered vaccine now, at least on one occasion. If not, we're getting set up to provide vaccine on an ongoing basis for those that want it there. So as best as we can, we're covering the jail, yes.
Doc, I've seen this in the comments, and a couple people ask, but either they had COVID or their child had COVID, and they were told 3 months before they could get their first COVID vaccine. Can you clear that up?
That's not true. I'm sorry, it's probably a misunderstanding from what I mentioned about monoclonal antibodies. So 3 months is 90 days. So those who receive monoclonals are asked to wait 90 days. But it is only for those who receive monoclonal antibodies. So if you've just had an infection or think you've had an infection and you're better and you're past that isolation period of 10 days, you can get your first vaccine.
And it's not something you said they said, it's their doctors have told them that. So
well, then their doctors misunderstand the guidelines. And they feel free to ask them to give me a call or check on our website. We'd be happy to talk to them. There's a lot of changes, and I'm not being dismissive. There's just a lot out there. It's easy to be confused, right? It's 10 days and 14 days and 90 days, and it's easy to lose track of all the guidelines.
Speaking of the monoclonal, why do I need to wait 90 days after getting that?
Well, the monoclonal is a passive antibody. It circulates in your body for a period of time. I would assume that's probably about 90 days. And during that time, it could impact your own body's immune system. So basically, the vaccine wouldn't work if you get it, or probably wouldn't work, or might not work if you got it within the time frame that the medicine itself was still in your system.
Rochelle says, I just wanted to say I had the opportunity to work alongside some health department staff last weekend. They were welcoming, very helpful, great experience.
We have some of the best staff in the state, I got to tell you. Shout out to, and the volunteers too. The volunteers have also done just a fabulous job. Very, very proud of everybody that's worked on this initiative. It's not been easy.
Sheila asks, is it safe to get vaccinated while pregnant?
So the definitive information on pregnancy is still not there, but there's a lot of reasons for me to say yes. Okay, number one, probably the most important, is absolutely not cool to get COVID while you're pregnant. We know that actually getting an infection with COVID does increase your risk for several things. So number one, we don't want you to get COVID when you're pregnant. Number two, there is no theoretical basis for a vaccine that doesn't contain any live virus to be of harm to a mother or an unborn child. And we've just been able to prove that with all of the previous vaccines we have. Number 3, in all the clinical trials, there have been women who've been pregnant inadvertently during the trials, and none of them had any adverse outcomes. Oh, I said 3. And actually, number 4, there was recently actually a study that was just released in the last couple of days that reinforced the fact that there was no increased risk of miscarriages, stillborns, birth defects, any kind of problem in women who received the vaccine just recently. So this, is that definitive? No, but everything is pointing to the fact that it's okay. And we always ask you to have this conversation with your OBs, but I do know the OBs in our community are also very comfortable recommending the vaccine. So I would say, again, risk benefit. What's a greater risk? Well, right now, the greater risk is for you to get COVID. So unless you're somebody that can stay at home and not go out, not do anything, I would consider the vaccine, even if we're pregnant.
All right. How many have you found that have gotten the vaccine and still had gotten COVID?
What did you say, 20? Less than 20 of what we know, huh? Fully vaccinated. So it's a really, really small amount of people. And remember, we don't know about all the cases, but the ones that we do investigate has been a very, very small percentage. And I mentioned earlier some of the other studies that have gone on nationally through occupational programs where they know exactly how many people got vaccinated and they know exactly how many people get infected afterwards. It's like less than 0.001%. So it's a small number of people. We're very pleased with how the vaccine seems to be working.
This is from Sue. If I want a certain vaccine, how do I know where it's available?
Well, you probably won't. Sometimes we announce our vaccine clinics based on what product we have, especially if you are our second doses. We want you to get the same product for the second doses if you had Moderna or Pfizer. We're encouraging people to get whatever vaccine is available to them. They all have very similar efficacy and safety profiles. You are always if you come to a vaccine clinic and we're offering a vaccine that you don't want, you can always decline and come back at another time. We'll always try to help you understand, what we think might be coming in. But I don't have a good answer for you, to be honest with you. We don't host Pfizer clinics. Now, I will say, if you want Pfizer, and that's what we're going to be focusing on in our school clinics, because that's the only product we can use for 16 and 17-year-olds. So if you go to a school-based clinic, you're going to be looking at Pfizer with that. But for all the other community-based clinics, we use whatever we have. We're not using J&J though right now, so until it's approved to be used again.
Somebody wants to know, are we going to be doing any clinics in the western part of the county now that we have the
yes,
guard?
I hope so. I'm so sorry. I ask that question all the time, and we're working hard on that. Well, hopefully the school clinic will help. We have a few pharmacies out there with vaccine now. The Yale Pharmacy has a vaccine. I think there's a medical clinic out there as well. But yeah, we're working on one right now in KPAC, and I know we said we were going to do that a few weeks ago, and it just has become just been a kind of an issue, but we'll keep working on it. But there is vaccine out there at your pharmacies, so do contact them, and you could probably get vaccines quite easily in that method.
And there is going to be that partnership with St. County, right, in Croswell at the Wesleyan Church.
Yeah, shoot, I should have printed that. So Wesleyan Church, I'm sorry, do we have the dates for that, Jen? They're running a clinic. We're looking at having a clinic at KPAC at the Council of Aging Center. Probably not next week, but the week after. We certainly hope, as the weather gets better, to have more drive-through options for people. And that would definitely be easy to do out there. So
yeah, I've got to look that up, but there is that one in Croswell that St. Clair County schools, people 16 and up are welcome to come to. Okay, just because we're running out of time, I wanted to get to these last few questions. Do you anticipate the vaccine being required for children to enter school or childcare?
I think that's going to be a no, I don't know. That's a $64 million grant. We don't even have vaccine for children right now. So again, that's probably the last thing we're going to be struggling with. I think before we struggle with that, we're going to be struggling with the issue of vaccinated people being able to do some things that unvaccinated people can't do, and whether or not we can ask proof for that. There are already businesses that are discussing this because, quite honestly, it's vaccinating their workforce or their clients is a way of maintaining their business. So it's a way of keeping their businesses from having to keep shutting down and opening up. Businesses are struggling just like everybody else with a lot of cases. So I think that's going to be the first conversation we're going to be having is, this idea of vaccine passports. Can you show your vaccine, proof of vaccine, and be able to go to a gym, for instance, or shop at a certain time, a special time with other vaccinated people so that you can have less risk. It makes a lot of sense, but obviously that road is fraught with difficulties and problems, and but we're all trying to figure that out, so we'll see.
Doc, this person wants to know that they said they were very sick on Monday. They went to MedExpress. They were completely symptomatic. They refused a COVID test at first. They pressed for it and was given one, but the person was very irritated about it. Why?
They're tired. I don't know. They should test. I'm sorry, if you're sick, you should get tested for COVID, especially right now when we have so much cases. Maybe she was tired, or the lady that he said, so maybe she was tired. Maybe I don't know. But people are people, and sometimes they're not in as good a mood as others, and sometimes they have issues that maybe we don't know about. So I'd prefer to give her the benefit of the doubt and seek your testing elsewhere. There's lots of places you can get tested.
Bob wants to know, will kids be returning to in-school learning?
Well, I sure hope so. Each school district is kind of wrestling that with within themselves and with their boards. Different levels of comfort depending on the situations in the school. Certainly, most of the schools have kind of stabilized with their pauses. Their teachers are ready to come back to school. They don't have a ton of cases, obviously, ravaging through their classrooms. So I think they're all hoping to be able to get back, but the case rates are still pretty high. And we, as a health department, are, as I said this last week, are neither recommending for or against that, but we're no longer strongly recommending for them to pause or to not be in person. That strong recommendation came when our cases were exploding and there were cases in every school building and there was all kinds of transmission going on. So now that this pause has happened, everyone's had a chance to kind of regroup, and I actually do hope that we start getting kids back in the classroom, and hope this time that we can maintain it until the spring.
All right, we have 3 minutes left before we have to say goodbye, but someone asked, can my son who's 27 get only the Pfizer?
Well, I just mentioned if you go to one of our clinics and you ask for Pfizer, if we have it, we'll try and give it to you. If we don't have it at that particular clinic, you'll have to come back at another time. At 26, he's obviously eligible for any of the formulations. So a lot of our clinics are not Pfizer clinics because we're preferentially using them for the 16 and 17-year-olds, right? So
yep.
It really depends on the clinic, but I would suggest you show up. And really the nice thing, it's kind of a bad thing for us, is that the demand is not there. Our clinics are very rarely are there lines anymore. A lot of the nice people have said they were in and out. That's probably the experience you're going to have. You're going to come in and you're going to be right out the door. So hopefully you won't waste a lot of time if you come looking for a specific product and we don't have it. That's the best I can tell you.
All right, and these last two questions, someone said, what would you look for if you have already had your shots?
What would you look for? Meaning
Not sure
for
if they're
COVID?
talking about, yeah, that might
Same
be what they're
symptoms,
talking about.
right?
Okay.
Hopefully a lot less severe, but same symptoms. So if you've had your shots and you're getting a fever and body aches and, you're starting to cough, runny nose, all the things that we see with COVID, remember, it's primarily a respiratory symptom. disease, then just go get tested. It's a lot less likely, as I mentioned. And if you're sick after a COVID shot, don't forget to check for other medical problems as well, right? Especially if you get your COVID test and you're still feeling crummy, take care of yourself and make sure that you don't have something else, some other kind of pneumonia or some other kind of infection.
Okay, and the last question of the day is, of the 20 vaccinated who tested positive, were any hospitalized or died?
Less than 20 is what my informatics guys tell me. And none of them have died, and none of them have been hospitalized. Correct? Correct. For us, for what we know. And I can tell you some of there's data out there that does indicate this. We've had some hospitalized, and I believe there was a documented death and somebody was fully vaccinated. But again, exceedingly rare, exceedingly rare. We're talking about populations of millions and millions of people. So that's the good news.
And Mary, this is the last question asked. Do you know when the J&J vaccine will be back?
I don't, but there was a special ACIP meeting again this afternoon. I'm anxious to get back to my computer, yay, and read about it. So we'll let you know as soon as we get the word. We'll leave this up to the scientists and the experts to weigh in. There's a lot of data that they're looking at to try and understand what the risk really is, and more importantly, if there's a way we can use the vaccine and just use it in certain populations so that risk is even less likely.
All right. Well, we just wanted to let everybody know, thank you so much for tuning in today. Next week, we will not be having a live show. So if you have any questions, please send them to covid19@stclaircounty.org, and we will return on the first Thursday in May at 3:30. And thanks, everybody. Doc, any closing comments?
No, just hang in there, everybody. We're seeing the other end of this, and so that means that spring should be pretty decent. Let's just try and keep this going in the right direction. So thanks for all your hard work.
Thank you, everybody.